Welcome to Social Work Updates. In this video, we are going to talk about the social worker's role during pandemic. During disasters, pandemics, and other public emergencies, the social work profession delivers distinctive services to the people. Social workers play critical roles in disaster response, recovery, and disaster preparedness planning for future events, and professional social work services are required in the event of emergencies and pandemics. Despite the large number of verified illnesses and deaths linked to the COVID-19 pandemic, millions of people have been reported to have recovered, and many of the survivors will undoubtedly require and/or find their way into palliative and/or non-curative care services. In this case, social workers are expected to give the best and most compassionate care possible, which includes proper preparation. In the backdrop of racial, gender, and ethnic prejudice faced by marginalized groups around the world, the COVID-19 pandemic has resulted in a significant level of stigma and discrimination, particularly among survivors and infected people in underdeveloped nations. In this regard, social workers have crucial responsibilities in serving and protecting the most vulnerable during pandemics like COVID-19. The reason for existence of the social work profession is to respond to social problems arising from public social and healthcare challenges, Amadousoun wrote, in addressing COVID-19 in terms of its grave consequences on social conditions as a whole and in the lives of individuals, families and households, groups, and communities in particular is a professional imperative. In pandemic settings, a variety of mental health supporting techniques are needed to promote the lifestyle modifications and readaptation activities that are required after outbreaks, and this is something that the social work profession can help with. The goal of the social work profession is to promote social cohesion and stability, as well as social change development through people's empowerment and liberation, and social functioning restoration, all while championing respect for the sanctity of life and drawing on the ideals of social justice and human dignity. As a result, social workers have the responsibility of performing a critical and frontline role in assisting and supporting communities affected by COVID-19. Social workers' responsibilities include preventing the spread of COVID-19, ensuring the most vulnerable are included in planning and response, organizing communities to ensure the availability of essential items such as food and clean water, advocating for the most vulnerable social inclusion into the social service system, and facilitating physical distancing and social solidarity through campaigns and orientation programs. Social workers must acknowledge that stigma contributes to people's isolation and prevents them from receiving care and assistance, which contributes to disease spreading. As a result, social workers must take on the responsibility of raising knowledge and countering myths about the epidemic, fear, and stigma in high-stress situations. Given the dramatic impact of pandemics on families and people, social workers are needed in healthcare systems as well as in poor homes with inadequate or no medical health insurance and/or a lack of understanding about how to obtain one. As a result, the function of social workers must be that of a counselor, educator, and referral link to health care facilities. Given that people and families seek comfort in a number of things, social workers' interventions in these roles should focus on strength-based practices, relationship-building tactics, and resilience, as well as a mix of spirituality. COVID-19 poses the greatest threat to the elderly. Physical separation has hampered social workers' connection with and care for the elderly. Social workers will look into leveraging and promoting kinship care and support activities as a means of supporting the needs of the elderly. In the event that parents or guardians die as a result of a pandemic, social workers must offer safe spaces for children or minors, ensuring that they receive enough shelter, health treatment, and nutrition. This will eliminate or lessen the psychological pain that the children may suffer as a result of a lack of parental care, stigma, or rejection by other family members due to contamination fears. In the event of a pandemic, social workers can advocate for the social inclusion of the most vulnerable into the social policy support system. Given that response platforms are offered by and within organizations while communities are on the receiving end, social inclusion advocacy becomes critical to maintaining social protection for the society's most vulnerable and marginalized individuals. Advocacy could be done on many policy response levels depending on how appropriate it is for the current circumstances. This could be for short-term policy initiatives such as cash transfers or in-kind distributions of food, clothing, and other necessities to the poorest households. On the other side, advocacy could be for long-term policy solutions, such as providing inexpensive healthcare for the most disadvantaged, investing in health and social care facility infrastructure, and providing affordable housing, among other things. The International Federation of Social Workers stated in 2020 that social workers' responsibility as a profession is to advocate for the strengthening and advancement of health and social service systems, which are critical in protecting people from the virus, reducing inequalities, and addressing social and economic challenges. In addition, social workers must play an important role in mobilizing communities, organizations, and groups, as well as facilitating connections between government-run systems of care and community-based systems such as community or district social welfare workers, child protection officers, and community development officers. Various levels of unconfirmed statements have been conveyed through various media platforms in the past, most notably social media, during outbreaks such as COVID-19, Ebola, SARS, and others. The majority of them are deceptive and could do greater harm to the uneducated populace. In light of this trend, social workers must play a critical role in effective communication, orientation, and public education about the pandemic. This is to keep the public informed about the true situation of the epidemic and to avoid social disruptions induced by fear, rumors, or inaction on the part of competent authorities. The necessity of carrying out these duties in accordance with professional social work ideals such as service, human rights, integrity, social justice, human dignity, confidentiality, and human relationships is emphasized. Messages are to be developed around hope, resilience, and the resolve of the human spirit to overcome any hurdles, especially during the advent of a pandemic like COVID-19. And that's it. Thanks for watching. For more social work updates, please watch and like the video, hit the bell and subscribe to my YouTube channel.